Okay, hello everyone. This is our April 15th briefing, where yesterday we didn't have a whole lot to talk about and everything, as far as a lot of updates. It's just like this thing is so fluid and there's so many different things happening that we do have a lot of stuff to talk about today. First and foremost, we've lost another person in West Virginia. And that's our 10th death. From the standpoint of looking at it on a national basis, it looks like West Virginia is doing great guns. But I said it over and over and over. Now it's 10 too many. And with every one of these deaths, there's a name and there's a family. And so all of us in West Virginia, especially Kathy and I, but all of us, join in your prayers and your thoughts and everything for your loved one, and you won't be forgotten. It's just this tough stuff. And so we lost a 62-year-old male in Marion County, and I just hate it. Nevertheless, there's no choice but to keep on moving and to try to at least keep moving north. The other thing I want to report today is in regard to workforce, we're continuing to try to catch up. It's easy to say that we've been we've been covered up with lots and lots and lots of claims, in excess of 130,000, I think, at this point in time. During that same time period, we would have probably processed somewhere between 3,000 and 5,000 claims on a normal basis. When you try to jam into a jar, something that's 40 times as much, jamming in that jar gets difficult. A lot of people have done a lot of really, really good work. There's no question about that. But you still got a lot of people that are home, that are hurting, that are waiting on us. So today I am very pleased to tell you that now we are invoking on a new methodology, and one of the parts of the methodology is just this: is when you call, you're going to be registered without any handicap. You're not going to be receiving a debit card that takes 7 days or whatever to fund that debit card. You're going to get a direct payment right into your bank account, or a check that's going to go out, and it's going to go out very, immediately. We're catching up fast. I'm joined today by our General Hoyer and Dr. Clay Marsh, and they'll tell you more about this as we go forward, but we're catching up really fast. It's been reported to me now because I continue to scream to the mountaintops, that I don't care. I don't care how many people it takes. We've got people that are sitting at home that are worried sick about a lot of things, and they don't need to be worried about when their check is going to come because they've got power bills and everything to pay. I get it totally. I understand that with all in me, and we're pushing really hard, and I've been told that we should have all claims processed and caught up by the end of next week. And so I think we're making real progress, but at the same time, if you're one of those that is still sitting there and you're hurting, it's not good enough, and I get it. Okay. I want to report that the Paycheck Protection Program that rolled out, in regard to basically forgivable loans that were to our small businesses across our nation. The Small Business Administration was, the dollars were allocated for that. This number is an enormous number the way I see it and everything, but I've been told that as of April the 13th, there's been 5,211 loans approved for West Virginians that have qualified for small business loans, in a total of $1,054,712,809. And I need to surely pass on thanks again to President Trump and his administration for quickly standing up for this. They're trying to get more monies, into the funding. They had $350 billion in the beginning, and they're trying to get more monies pumped in because they've been overrun by people in small businesses that we need to be taking care of because they're trying to take care of their employees. And as these small businesses receive these monies, then we can get a lot of people off of the unemployment and get people being paid and directly from the businesses. They're trying to get an additional $250 million or $1 billion pumped into that. Of course, you know what's going on there. You've got, and I hate to say it, but it's just true. You've got Nancy Pelosi and the Democrats, are fighting back and forth with one another, whether it be the Republicans or the Democrats, and they say they're not going to come back till May the 4th or something like that, and you got people that are hurting, and that's not acceptable to me. I want to reiterate in regard to our schools that I will never, no way on this planet, am I going to think about putting our students or our teachers back into a school setting until I have been advised over and over by our experts that we're good to go. I don't want to take away hope, because I'm hopeful that things are going to continue to get better and we will be able to go back to school for a period of time, but you can rest assured that there's no way on earth that I'm going to condone going back unless it has absolutely been brought to my attention and advised to me over and over and over that we're in great shape to be able to do so. Let me jump over to nursing homes. Today we have 2 additional nursing homes, one in Kanawha County and one in Boone County, that are reporting a positive, and both of them 1 positive test. When that happens, our guard and DHHR were all on this, everybody all in. We need to run to the nursing home, test everyone there, everyone that's affiliated with that nursing home, to where we can isolate and move forward. Now, with that, I'd like to say just this. It's been brought to my attention in regard to reporting, and all of our reporting has been done well. It's just that some of it is drifting in on a different timetable, and therefore it looks skewed or inconsistent. And so what we're doing right now, and you'll hear from Dr. Marsh and you'll hear from General Hoyer, we're bringing in additional resources to amp that up to where that our reporting is better and better, and it's more timely, and it's absolutely accurate. I'm not going to tolerate it being inaccurate in any way, and you'll hear more about that from my team. I want to touch on just one, I want to remind you again about the census as you're, and maybe we can put that up real quick, as you get this in the mail, or you can go online and use this to make sure that you're counted. That's incredibly important to all of us. I guess the last thing that I want to talk to you about is the transitioning over to what we would call our phase 2. Now, as we begin that transition, and let's just hope and pray that our curve continues to stay rock solid and drift down and down and down. And then let's say that all the experts and everyone, we're moving into an arena to where we're transitioning over to be able to bring people back to work and bring communities back and everything else. And as we're doing that, things are going to be somewhat different, for sure. We're not going to be able to rush right back out and get ourselves in a bigger mess than we've already been in, and we have prevented a catastrophic mess, and we don't want to rush right back out and do things that are going to cause us to have a relapse that would be much greater than what we've contended with the first go-round. So as we do that, there's lots and lots of contingencies that are already in the works on how we're going to be able to go about doing this, and as we move further down the line, we're going to have people again talk today about how we're going to be able to test on a widespread basis in a much more dramatic way than we've done before, and isolate. And I'm not going to steal anyone's thunder. You know, Dr. Marshall's going to talk to you a bunch about that. I really don't think I've got anything else that, you know, right now other than just to tell you just this. Oh, I've got one other thing. Your election holiday date has now moved from May the 12th to June the 9th. It will be June the 9th, and I am very, very, very hopeful that we will not have to have a lot of votes go in on an absentee ballot basis. I am very hopeful that you will have the right to do what you've always done in the past, and that will be you will be able to go to the polls and you will be able to vote, and we'll be able to keep you apart, you know, if that need be, and you'll be able to enjoy the right that you have in this great country to be able to turn out and be able to vote. You know, there is always suspect with absentee balloting, you know, from a corruption standpoint, and I'm very, very hopeful that on June the 9th we'll be able to go to the polls and you'll be able to exercise your right. I guess the last thing I want to tell you is just this. Continue to work in every way possible from the standpoint of the stimulus dollars. The dollars are phenomenal, and they can help you in many ways. And I urge you as businesses and as individuals and as self-proprietors and independent, you know, contractors and everything, as you're able to file and everything, push every resource and you know, and I've told you and told you and told you, but the dollars are unbelievable. And I think at the end of the day, what's going to happen is, I made a statement yesterday that I do not think we're going to have to lay anybody off. I don't think we're going to have to cut services in our state. I think the backfilling that's going to come from the federal government will bridge us into next year, and I hope and pray that we'll have either drugs or vaccines that will put us on our way and to where we'll win and move past this terrible virus. So that's all I've got for today, and I'll pass it on to others now.
All right, next let's go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. 602 men and women of the National Guard on duty have completed 388 missions. Some highlights of today in the last 24 hours. As the governor mentioned, we continue to ramp up the testing capability. We were able to secure a significant number of test swabs, which were part of the shortcoming, and are developing a relationship with a West Virginia lab to continue to improve throughput. As the governor mentioned, in conjunction with Department of Health and Human Resources, Public Health, and Kanawha County Health Department, the governor tasked the National Guard to support testing at both Boone County and Kanawha County for the nursing homes that were mentioned. Another piece related to innovation, a unique piece that's come forward out of West Virginia, is West Virginia University team has developed an intubation box that helps protect healthcare workers. Those are being sourced through a company in Ravenswood, West Virginia, and the National Guard will help push those out to the key locations around the state that can use those. Again, something designed to better protect our healthcare workers going forward. As the governor mentioned, good progress at Workforce West Virginia. Over the next 2 days, the rest of the phone lines will be transitioned to the Amazon Connect system, continuing to meet the governor's demand for us to press for innovation to improve capability. In the next 2 days, we believe that a decision will be made related to an additional innovation and automation system for customer relations to, again, continue to improve, not just for this event, but for long-term going forward. Continue to have great success with the feeding programs and stabilizing folks both in our children and our senior population. Just to point out that the West Virginia National Guard still continues to do its military mission. Not only do we have approximately 900 men and women overseas, but in the past 24 hours, the 167th Airlift Wing out of Martinsburg was tasked by the Department of Defense for a FEMA mission to fly overseas and pick up supplies and bring them back into the United States for the COVID response. So men and women of the Guard are still doing their military mission day to day and executing in a very professional manner. Just to highlight a couple of things to close out, Governor Justice continues to press both Clay Marsh, Kathy Schlemp, and Bill Crouch and I and the whole team on what are we looking at for this next phase and how do we work to get on track. And as you heard, the governor pressed us to put more support into the data analytics, which will provide that support to make those things happen. But a couple of key areas he continues to press us on, I think is important for the citizens to understand. One is to be as self-sufficient as we possibly can, both with the current phase and going forward. The next is to continue to press innovation, whether it's in workforce or PPE, production of swabs, whatever it may be. We as West Virginia have got to be prepared to be innovative as we go forward when dealing with what is a worldwide pandemic, something that none of us have ever seen before. So we continue to take those as well as the data piece and take that direction from the governor to press forward to be highly effective and capable in those areas. Thank you.
All right, thank you. Next, let's go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you, and it's really wonderful to be with everybody today. So I want to focus my comments on just a few things. So number one is I want to talk a bit about data. The governor has asked us all to look at the data, certainly at the DHHR dashboard, as well as to look at how we can create information that is not only accurate, but also very timely. And what we have learned is that there's really two different sources of information that are kind of colliding, and we will clean this up. So one source of information comes from all of the county health officers, and that is pulled through the GARD and DHHR, and certainly with the great cooperation of all the county health officers once a day at 5 o'clock, and that's really the graphic that comes through on what's going on with the COVID positive people, where they are, what percentages, and updates that. That's data that's pulled and done in cooperation with the county health officers. Much of the rest of the data is from reporting that is required by the Centers for Disease Control. So all of the rest of the data needs in many ways to be validated. So things don't get updated as quickly because sometimes these epidemiological studies haven't been done yet. And also the way that the data is generated and the way it is pushed out is not necessarily like, for instance, let's talk about the data from Wayne County. So there was a number of people that tested positive for COVID in a nursing home. Some of the people lived in Wayne County, some didn't. So the way the data is applied is if you live in Wayne County, you finally end up being given that on the Wayne County list. If you live in another county, the data is applied that way. So it gets confusing when you try to match up all the numbers. So we are going to clean up things. We're going to make the dashboard much easier to read, and we'll keep it updated with the most current data that will be updated at 5 o'clock every evening, and I think that's going to be improved a lot. The data is accurate all the way around, but it's just different the way it's reported. So the second thing I'd like to talk about is, as the governor mentioned, phase 2 of where we need to go. So we know, let me say one more thing about the data. The other thing is we've talked a bit about seeing a reduction in number of cases daily, and we're looking for that for 8 to 14 days or so. So when you have a cluster, an outbreak that happens at one place, that's different than if you have an outbreak that happens at multiple places in the community. So even though those numbers will make that trend line go up during the day that we get those results back, that's different, and we would look at that differently in a clustered in a single place versus if we saw that many cases that happened in a community spread. Second thing I want to talk about briefly is phase 2 of where we need to go. And as the governor said, we are very optimistic and very grateful for the incredible work of West Virginians to not only flatten our curve, but have a national, almost leading best rate of conversion, and our mortality rates and case fatality rates are very low compared to national and international, and that's really to the great work of you. But in many ways, we have taken that in a kind of a blunt object approach. We have asked people to stay at home, and we've asked people to socially distance, and we have instructed non-essential businesses to close, and this is really the governor doing this. We've made health advisement. And at this point, we have done, as a state, incredibly well. And as we come back out again, we need to become much more like a scalpel than like a hammer. And ultimately, we need to have the ability, as the governor said, to test very broadly. We have to think abundantly and create the resources to enable that. As we see moving from the tests that we do today on COVID, which really tests for the genetic appearance of the virus in people, we need to move to looking at tests that tell us whether people have immunity toward the virus. And that's a second type of test that is being developed around the country that we're also working on in this solving problems inside the state of West Virginia. When we test and identify people that have COVID positivity, we need to very rapidly figure out, and this is the best practices from countries in Asia like Singapore that have done a great job with this, is identify those people and their contacts and isolate those people versus everybody so that we can reduce that person-to-person spread, as we've said before, because we don't want that surge to happen on this phase 2. And we feel very optimistic that the way that the citizens have responded and cooperated, which is really critical, that we will be able to avoid that as we help open businesses and start to be back together again. And so our job is to create these capabilities, and these capabilities really haven't existed in our state or our country to the level we need to do it, but we are very excited and we are very committed that we will be able to accomplish that. And then also we need to create the sustainability with the ability to produce PPE, and as General Hoyer and his team have done with our innovation groups, we are now making masks, we are looking at making gowns, and so as West Virginians have been self-sufficient in the past, we, I think, are leading the way and will continue to do so. So there is a lot that's being done and a lot to do. We are committed to trying to move as quickly and as safely to get people back to work, to get people back to school, to get people back together. But as the governor has instructed us to do and has been an absolute national leader doing, the health and well-being of our citizens, of you, is the primary responsibility that we all have to advise the governor and let him make the best decisions as we bring West Virginia back together. And by doing exactly what you have done in collaboration and cooperation, I know that we'll be as successful in phase 2 as we've been on phase 1. Thank you.
All right, thank you, Dr. Marsh. Secretary Bill Crouch and Dr. Kathy Slimp from the West Virginia DHHR are both joining us again today and are standing by for questions. Once again, we are holding today's briefing with media members joining us virtually to practice good social distancing. Our first questioner today is Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. The Centers for Disease Control and FEMA have put out what sounds like a roadmap to potentially reopen states around the country. The Washington Post got a copy and reported on it this morning. There are 4 bullet points for when areas may begin to consider reopening. Those are the incidence of infection is, quote, genuinely low. Second, a well-functioning monitoring system is capable of promptly detecting any increase in incidence of infection. Third, a public health system is reacting robustly to all cases of COVID-19 and has surge capacity to react to an increase in cases. And fourth, a health system that has enough inpatient beds and staffing to rapidly scale up and deal with a surge in cases. I realize that's a lot to take in, but where do you think West Virginia stands on those standards?
Let me make a stab at this, Brad, and then I'd like Clay to come in behind me. But you know, I was just making some notes here earlier and everything, and I was just thinking about, you know, here's the thing, and I want everyone to really pay close attention to what I'm saying. But here's what is going to begin to happen. Things have gotten better. You're going to hear more and more and more noise about going back to work and getting our engine restarted. And I want everyone to understand nobody on the planet wants to contribute to helping the engine be restarted more than me. You know, I absolutely want us back to work. Now, I want everybody to understand without any question, I want us to go back to work. I want us to be able to go back to our lives and enjoying our lives as best we possibly can, to where today things are troublesome, to say the least. But I would say this first and foremost. My job is to protect you. And until we get into a situation to where I feel like you're safe, I'm going to do my job. You know, I can, with the help of these unbelievable superstar experts that are around me, I can get you through this. I can get you all through this safely, and I can protect your businesses in our state as best I possibly can. Now, I can only do that with the expertise of the people that are around me, and they are pumping information to me like you can't imagine. Now, Brad, you mentioned just these things, and I wrote them down. You know, that the infection, 4 things that the CDC is saying, that the infection is low, that we have the ability to really monitor, and we have a public health system that is absolutely working and doing good work, and we also have a public health system that has inpatient beds in case we've got a surge and we've got to go. Now, I believe that these experts, and especially Dr. Marsh, General Hoyer, Kathy and Bill, and all the people that are pumping in information, will be able to move us into a situation to where we will very confidently be able to move forward in the future. And we will be able to move forward as quickly as possible. I also just caution just this. All would be forgotten very quickly if we moved into a stage quicker than we should, and then we got into a situation to where we had people dying like flies, and that would be really bad. On the other hand, you know without any question that if you don't restart the engine, people are going to die as well, from drug overdoses to suicide or whatever it may be. You know, that could be catastrophic on the other side. It's tough balancing act as to know what to do. And absolutely, at the end of the day, there's probably going to be no winner. No matter what you do, there'll be no winner. That's okay with me, but at the same time, I want to get as close to being right as we possibly can be. And these guys with me, and Kathy, and all the King's horses and King's men that are out there and around me, will be giving us the right information, and we'll be making the very best decisions for our people we can make.
Yeah, it's really hard to follow that because I could not agree more. And I think, again, the governor's demonstrated to me on every possible situation that it will always be, any decision will be informed by the health and the safety of our citizens. What I would say is, Brad, that those 4 steps are exactly what we've been talking about. So we're looking for the case rate of positive cases to come down over the next 2 weeks. We're trying to amplify our ability to test and to isolate, the scalpel, not the hammer, on the public health side. We're certainly looking at the surge capacity of our hospitals and ICUs and trying to continue to ask everybody in West Virginia that's doing such a great job to work cooperatively with us to do the right things so that they are protecting themselves, which protects their neighbors and the vulnerable people in the state and our healthcare workers. So I think that we are following that recipe almost perfectly, and we are generating the capability, I think, in the very near future to be able to meet many of those requirements. And then it will be up to us as a state, and certainly given the information from a health side to the governor, so that he can make the best decision for the interests of the state of West Virginia.
All right, thank you, Brad. Up next, let's go to Aaron Beck with the Register Herald.
Aaron Beck, Register Herald. The American Medical Association is recommending that states that require one-to-one syringe exchange programs begin no longer requiring one-to-one syringe exchange programs, allowing people to receive multiple sterile needles based on need. They've also suggested that states designate supplies provided to harm reduction programs as essential services and expand PPE priority to include harm reduction organizations. I've learned from DHHR that all harm reduction programs in West Virginia are limiting services. So I'm wondering if you, I know we don't have a blanket one-to-one policy, but many harm reduction programs operate that way. So I'm wondering if you would provide the resources so that they don't feel like they need to operate that way anymore, and that they can distribute syringes based on need, and if you will discourage one-to-one programs. And I'm also wondering if you're still tracking the HIV outbreak in Cabell County.
All right, Bill, you and Kathy are going to have to jump in on this one, please.
Yes, sir, Governor. Kathy will answer that.
Sure, Aaron, thank you for the question. This is a critical area. We know they can be exceedingly effective and are really important programs for communities. We are and continue to work with communities to make sure that they can operate and the most effective and evidence-based programs that really meet local needs. And so that is, we continue to do that work moving forward.
All right, thanks, Aaron. Up next, let's go to David Beard with the Dominion Post.
Hi, this is David Beard. I have a kind of a two-part follow-up to Dr. Marsh's comments. We've talked more than once about more expansive testing when we're able to do that. Are we talking about testing everyone, whether they're symptomatic or not, is the first part. And the second part, you talked about more targeted isolation practices, the infected people and their contacts. Are we still going to have to rely on the honor system for those people to self-isolate, or are there going to be some way to enforce that to make sure we don't spread the disease?
Go ahead.
Yeah. So David, thank you for the question. I think that if you look at many countries that have been successful related to the COVID pandemic, certainly they have tested a broader part of their population. And so certainly we want to be able to work up to be able to do that as well. I think currently what we're really looking for is to try to create a system of surveillance that allows us to start to understand areas that are higher risk areas. So for instance, we've talked before, the Eastern Panhandle, which borders, borders Washington and Baltimore, is an area that's surrounded by a kind of hotspot, so we would want to test broadly there. Northern Panhandle is the same. There are some areas in the state that still haven't had positive cases, and we may test those much less extensively. So we would be strategically driven to start to test a particular set of people that would then allow us to see not only people with symptoms, but also, as you are alluding to, people that may be pre-symptomatic or asymptomatic. When it comes to the isolation and public health issues, we have done very, very well so far with getting the cooperation of our state. And we know from mathematical models that it's much better to move in a cooperative way, much more effective in reducing the surge, flattening out the curve, as we have successfully done to date in West Virginia. So I think that we certainly would try initially to ask our citizens to be cooperative and to do the right thing, protect themselves, protect each other. If it became apparent that that couldn't be done, then certainly we would work with the governor and his office to decide how we might then move forward.
All right, thank you, David. Up next, let's go to Anthony Izaguirre with the AP.
Can you tell us the name of the Boone County Nursing Home and what's happening there and what the National Guard is doing there?
I don't have the specific name of the nursing home, that there is a request from the Boone County Health Director, and working with DHHR, will be providing support to do any testing that will be necessary based on what the public health officials decide related to the guidelines that Dr. Marsh laid out.
And Anthony, let me throw in this. I think that just came to us, probably 15 or 20 minutes ago. So I mentioned it, but it just came to us just a second ago.
All right, thanks, Anthony. Next, let's go to WCBC Radio with Paul in Cumberland, Maryland.
Good afternoon, Governor. Good afternoon, panel and fellow journalists. I question, Governor, about getting the state back to work when this is all over. Are you looking at a statewide order, or would you do it piecemeal, part by part?
I really don't know how to answer that. I mean, I could answer it just, and I don't mean this sarcastically in any way. How do you like your eggs? Would you like them fried or scrambled? And the answer is always yes. But in this situation, it would be yes. It could very well be that the experts come to me and say, within this geographical area, we're good to go, and we feel very confident that everything is buttoned up and we're good to go there, while there could be another area that's a hot spot that we absolutely don't want to go in that area, and so we could do a situation to where we're split up. It's just right now, right at this moment in time, right now, if you could just think about this, just almost no time ago, our curve looks like it's going really good. Then all of a sudden you've got these outbreaks in the nursing homes. Now they're not community spread, at least God forbid, not yet, and everything. And so therefore the impact of them is really just a particular hot spot. Even though we have a number of tests that can skew the curve, they are a hot spot, and they really should only be counted in maybe only as really one, a big giant one. But at the same time, if a community spread situation like we had jump out in Berkeley County is a different animal. But it may very well be that what we've got to do is split up a state in order to be able to get us back to work, and it may very well be that we can all go back at the same time. The net of the whole thing is we don't go back until it's safe to go back, and we don't go back until we have safeguards that if we go back and we have outbreaks, that we can handle them, and handle them promptly, and handle them in a way that doesn't endanger our people.
All right, thank you, Paul. Next, let's go to Kenny Bass with WCHS.
It's Kenny Bass with County Lake and Fox 11 in Charleston. I have a question for General Hoyer. Anytime there's innovation, there's always people who are concerned about change because you're doing things differently. When you talk about decontaminating these N95 masks that are being produced, there is some rumbling from nurses groups who believe that A, that material is not designed to be decontaminated, and two, since it's not the way they've done it, there are fears that those masks will not be decontaminated and present a risk to healthcare workers. So what steps can you take to calm those fears and concerns here in West Virginia if you mass produce those and move forward in a big way to get those back into the market?
Yeah, Kenny, great question. And as someone who's married to a nurse, I fully understand concerns of our healthcare workers going forward. So if you look at the process that we're currently using, it is a hydrogen peroxide vapor system that is currently used in hospitals today for other sanitization and decontamination. It's more sanitization than a decontamination initiative. The FDA and the CDC came out and said that the N95 mask is capable of being decontaminated or sanitized up to 20 times. But what we in West Virginia are doing based on the governor's direction is taking a couple of extra steps. We're fortunate at West Virginia University, they are partnered with the National Institute for Occupational Safety and Health at Morgantown. So we have a capability there to test. So for example, there were masks that were sanitized yesterday in Charleston area. They were delivered by the National Guard. A sample size of those were delivered by the National Guard to that center. They were swabbed and tested to see if there were any viral materials left. And then they were also checked to see what level of capability the mask retained. And we found that in the samples yesterday that they were sanitized clean, there was no viral material, and the mask itself maintained a greater than 99% capability rating for the mask. So an extra step that we were tasked to do to make sure that we do even better than what the national numbers lay out. If we see over a period of time that masks of those kind can only be sanitized up to 15 times and maintain their integrity and credibility, then we will work with the various entities around the state of West Virginia to change those numbers beyond what the national standards are telling us.
All right, thanks, Kenny. Next, let's go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I want to ask a question about the hero pay that was announced last week. Has that money been sent out to the counties, and what sort of oversight is in place to make sure that it gets distributed properly?
I think I can answer that, Charles. Today, I think the monies are going out today, and you know, there's instructions. There's an instructional letter that is going with those dollars. It's basically saying, you know, first responders or soldiers that are on our front lines, and we've got, and I fully understand, it'd be great if you could just say, these dollars are supposed to go only to Group A and Group C. But here's the thing, you know, you may have Group B and D that are performing duties that are terrific, and they're on the front lines and everything else. To me, you know, one that just jumps right out at me is, you know, from the standpoint of our grocery workers, the people that are checking people out. You know, they are oftentimes not thought of as first responders, but are soldiers on the front line, but they are. And so we want to give our counties as much latitude as we possibly can. You know, understanding that $100,000 is not going to take care of everybody in every situation, but counties should do the very best they can, and there'll be accountability that the counties need to send in as how they spent the dollars and everything, and so there'll be accountability for it. I mean, it's not perfect. It's not perfect by any stretch of the imagination, but how do you describe this person's a hero and this person's not? You know, and we're just trying to help out those people that are really stepping up and trying to do goodness around our state and help our people in every way. And so the other flip side of it is just this is, while this is only $100,000 per county, to our counties that are smaller counties, maybe that's a big bump. And to our bigger counties, maybe it's nowhere close to enough. And we looked at doing it and segregating it population-wise. But here's the thing that you've got to remember. There is real money coming. There is real dollars coming to the counties. And it's going to come very, very soon, you know, on the Fed and on the big Fed program and everything that's coming. Now, this is only a bridge, you know, to absolutely take care of people, as many as we possibly can, that are doing that great work right out on the front line. So you know, again, it's not perfect, but it's our way of trying to say, you know, we recognize you and we want to step up and try to help.
All right, we got time for one more question. Let's go to Amanda Barron with WSAZ.
Sorry, Amanda Barron from WSAZ. I wanted to ask about the complexities and the delicate balance we'll have to strike reopening the state when it comes to a place with a low number of cases, but in such close proximity to states where the number of cases is significant. And do you anticipate when it comes to reopening schools, potentially, that it might be different in one part of the state than it is in another, based on that proximity to areas with larger populations and a high number of cases?
Amanda, there'll be lots and lots of different constraints and a lot of things to consider before a decision will be made. And that's why I surround myself always, and I've done it all my life, that's why I surround myself with the most qualified and the very best experts that we can find. Clayton Birch doing a wonderful job, the Department of Ed. There is so many people around me that are going to have to weigh in, and we will all weigh in, and we will absolutely make the best decision that will be the safest decision, that will be the decision that will be made as promptly as we possibly can to go back to doing our lives the way, as closely as we possibly can, the way we used to.
All right, Governor, I'll turn it back to you.
Well, I don't really have anything else today, other than just to review real quickly. We've got situations in nursing homes that we're all over. You've heard from Dr. Clay Marsh and General Hoyer and Dr. Schlemp and Secretary Crouch and myself, in knowing that there's a lot of people behind all of us that are doing great work. And I appreciate them in every way. We're making great progress. In West Virginia, you're doing really good. I ask you again now to keep in your prayers 10 individuals that we lost and all their loved ones, and let's just keep moving and all stay together. When we start fragmenting and running in a lot of different directions, we'll have a lot of trouble. So let's keep moving together with the advice of all these great experts, and we're going to win this battle.